Hi everyone, welcome to Window Chats with Robyn, the Instagram live show where I'm sitting by my window and chatting with very interesting people. Today we have Janet, Dr. Janet. I'm very excited. Fun fact, I have never officially had a conversation with her, so this can go horribly wrong or amazing. And Janet is on time, which always makes me so happy. I'm going to invite her in. Hopefully Instagram works. I mean, that's the fun with the lives. You never know. It worked.
Hi.
Oh, your audio is great.
Oh, that's good. These are like airplane headphones, so A1 to them.
There you go. Okay. The audio sounds a little echoey on my end, but is it okay for you?
Yeah, it's a little echoey for you.
Just a little.
Okay. Do you want me to try taking the headphones out?
Or yes, let's try that.
Okay, let's try.
Okay.
How's that?
So, yeah. Oh, that's better. That's a lot better.
You may hear I'm in my office, so you may hear like the sounds of my office still going on outside.
That's totally fine. I mean, I see a degree behind you, and now see, you're legitimately, is it your degree?
Yeah.
As I'm looking closer.
I found a stock degree and I just put out there so I would look legit.
I should totally just put my physio degree. I swear I have it. I think it's at my parents' house. I never know what to do because I find if I was in a clinic, I would leave it on the wall, let people know I'm legit. But it seems weird putting it at my house. Who am I trying to impress?
I know. I have all my degrees up here because most of the time people come in and they look at me and they're like, well, they just say like, you're too young to be a doctor. Or like, are you sure? Are you Dr. McMordie? I'm like, yes, there's a lot of expensive wallpaper on my wall, thanks.
Well, you look super young, so I understand. But I would like to think on it, sunscreen. Oh, there you go. I love it. Dr. Plug for sunscreen. We're sponsored by Neutrogena. What is your favorite brand of sunscreen?
Ooh, I don't actually know, but I am using, there's a Canadian skincare brand that I really like. It's called Reversa, and it's from Quebec. And I like it because you're supporting Canadian skincare, and well, small business, I guess. I don't know how small they are anymore. They've kind of blown up. They've become quite popular, but it's always nice to support Canada.
I love that. Reversa. Does it reverse aging?
That is the hope.
Reversa. Okay, I will look into that. I always get homework from these Instagram lives, but thank you for agreeing to do this. I was so excited. I'm thinking a doctor who's also interested in acting. Look at this.
Yeah, I was hearing right when I was logging in about, we've never actually met before. We're just pandemic friends, which are my new favorite type of friends.
They are the best because we found each other in, if I'm not mistaken, it was LB acting. Yeah, Louis Beaumender was having this Live with Louis morning chats, which I loved because I think he's adorable. And it was just such a positive Zoom environment. And
so great.
It was. And it was just everyone talking and discussing and no judgment. And then we connected after that. And I thought, I'm very intrigued by this person. So I was just always excited. Oh, yeah. Like, so I'm like, oh, health and acting? But that's me.
Yeah, I loved those chats. I was sad when he finished them. But yeah, they were so nice. It's just nice to, I don't know, connect with people outside of the medical world. But yeah, he's just lovely. Like, oh my God, what a wonderful person. This whole acting, everyone in that studio is just wonderful. But yeah, he's just what a guy.
I agree. And they're still, again, I don't know if they still have the space, but they're still doing online stuff. And I think a lot of acting schools, I'm not biased towards one or the other. I love Louis.
Yeah.
But a lot of them are going online now just because it is what it is. And honestly, the future of audition seems to be either self-tape or Zoom audition. So it actually makes the most sense. Practice what you're doing.
Yeah. And I think, well, I definitely have benefited from that because I don't live in Toronto. I'm about an hour and a half outside of Toronto, which is fine because like anywhere from where I live, it's an hour and a half to get anywhere, so whatever. But it's the benefit of being able to join classes like this that are, you know, world renowned. And my agent was like, you need to be taking classes like this. I'm like, I don't want to drive to Toronto, but if I have to, I have to. But being online has been awesome. And it's funny because like people are talking about, oh, when are we going to get back into the audition room again? I'm like, I don't even know what that is because I was not even into acting before. So all this self-tape stuff, that's just what the world is for me. So it's never been any other way.
So what gave you the acting bug? I'm putting you in the hot seat.
Well, I think as most actors I chat with, we all were like acting theater kids in high school. I definitely was. I was, you know, in the plays and the musical. I was in like a touring theater company in grade 8. And then, you know, life kind of hits you and you either pursue it from a degree standpoint, or you just veer off in another direction, which is what I did, and then never really did much going through medical school, and whatnot. And yeah, and then when the pandemic started, I just started doing a little bit of background work right before the pandemic hit. I was like, this is fun. These are people that I never get to chat with, these creative people that I used to love. I mean, people in the medical field or in the healthcare field are creative, but it was just neat to kind of meet more people. And then COVID hit and all the stuff went online, and I was like, hey, bonus, let's enjoy this and try and do something fun and creative to not burn out from a medical standpoint, because we were getting pretty close to that, I think, and still are, obviously, fighting this pandemic. So it's a nice like break. I mean, it's hard. I'm exhausted after class, but it's such a different part of my brain that I'm using. It's awesome. Yeah.
Absolutely.
Yeah.
I find there's a lot of my friends in the healthcare field that have that creative side of them. And so I love that you're exploring that. And I love that you brought up being an extra, because I know we discussed background work.
Yeah.
And that's a whole other field of, that's hard. That's hard work. Because it's almost, you're in the background, so you're not the star. You can't pull the attention, but you also have to be a human, which is my struggle on a daily basis. How do I be a human? So it's a fascinating process. I really do enjoy watching the people in the background when I watch those TV shows or those films. That's, I mean, not knocking any of the stars, but I always look out for the extras.
Absolutely. And it's definitely a world of its own. You know, there's some very interesting people who have chosen this career as their career with no kind of ulterior motive of I want to go move up the ladder and become the star. It's fascinating to be, you know, a walking set piece, as I like to call it. You know, just don't pull attention, like you said, but also, you know, don't look stupid and awkward in the background. It's interesting. And as we were kind of talking about how it's so much, not so much harder to get into, but they're so picky now, right? So they're so selective. You're getting like photo casted, just like you would be getting a audition, right? They're just scrolling through photos being like, yep, pick you. And yeah, at the beginning I was like exactly what we were chatting about privately about, doesn't everyone just get picked? Don't they just want people in the background? Like, I think I was telling you, I have submitted for Handmaid's Tale so many times, and they're like, no, not the aesthetic we're going for. I'm like, okay, fine. And now I've aged out of being a handmaid. I'm too old.
That's, you know what's amazing? Because again, I'm not trying to be ignorant, but don't you have a hood over yourself for the majority of the time as a handmaid? So what part of you did they not like? That's just my curiosity.
But you're right, it is so fun. I wouldn't do it if it wasn't fun, right? You know, I think because it can pull from my medical job, but if there's something that's a really fun opportunity, like I think a lot of people in the background world were involved with Nightmare Alley, the Guillermo del Toro movie they were filming last year in Markham. And so like he hired like 30 of us to be like continuity extras for this. And like, come on, I'm not going to turn down. If you're going to put me in a fun costume, I'll drive to Markham every day. I don't care. So it's like, you get the fun 1940s hair, the costume. Yeah, I'm going to be some brown blur in the background. You're never going to see me, but man, was it fun.
Well, it is, because you kind of get swept up in the world they're creating. And especially a period piece of sorts. I don't care how far back, even if it's, I don't know, 2000. I'm like, oh, period piece. What is this?
Yep.
What are different cell phones I'm holding. So it's just so fun being a part of that world they're creating. I love it so much.
Absolutely. And again, you get to meet all these really cool, interesting people. And they're like my pandemic friends, right? Where you just get to hang out on set and they're all fascinating, right? They have these creative backgrounds, or this is their retirement gig. Like I was standing beside, again, a guy at Nightmare Alley for like 4 freezing cold nights where they were like throwing rain at us. And it was just me and my new friend Carl. And he's retired. He was a principal for like 40 years. And he's like, now I just do background work. He's like, it's the best. It's so fun. I'm like, this is awesome.
I want to meet Carl. He sounds like a delight.
Well, he's in the background of literally everything. Like, he's like a period-looking face. So he was in like Queen's Gambit. He's in Murdoch Mysteries. Like, yeah, cool.
That is, but there are people that are professional background, and I do think if you're good, why wouldn't they bring you back? Because Absolutely. They know they can rely on you. I think that's a huge part of that work. Will you show up?
Yeah.
And I honestly, before we were discussing background extras, I never realized there was specific talent agencies for casting extras. That was completely new to me. And like you said, I honestly, the fact that you wouldn't be picked to be an extra just blew my mind. There was so many factors. Wait, don't they need bodies? I don't understand how this works. I have legs. I can do this. I'm very confused. But there is still a look. There is still a requirement. So it's, you know what? It's nice to be rejected from multiple sources, not just. But you know what? It also is. I admire anyone that can do background or extra, because I tried it once or twice just because I was curious. And then the only reason I applied for that other one we were discussing is, okay, I could be a physiotherapist and use that degree for something. Fine. But I just struggle with knowing I'm putting all this. I would always build a character as an everyone. So I have all this character work and all this prep work, and I go in, I'm like, they have a name, this is their backstory, here we go. And then I'm not even on anything.
No.
Maybe it was, I think my hair was in something. I'm like, oh, well, I had a good hair day, but okay.
You have to flex the creative muscles, and which is fine. I was on a pilot last couple weeks ago, and me and this girl that I met, we were like admin staff, and we literally were these blurs in the background. But her and I came up with this whole story, right? We're like, why not? There's nothing else to do. We're here for like 14 hours. Let's make it fun and flex the creative muscles a little bit.
I love that so much. I really do love that. Honestly, there are some times when I love being silent on camera because they just need to see the smile, and then I can say all this random stuff. And if you have a good improv partner, it's gold. It's just, you're just saying stuff, doing that commercial smile, whatever, and you're just saying things, seeing if the other one will laugh. I don't recommend doing that all the time. It really depends on your partner, and don't be mean. But it's when you have that connection, and then you leave that day feeling so energized, and it's But then it's also, what's the next project? This is so. I feel like there's such a high. I'm on set. Cameras are rolling, and nothing.
Well, and I think just that whole what's the next step thing in general, I think is so stressful, I think, for anybody who's in the performing arts, especially during COVID, right? Because it's been so sporadic. And it's interesting, like learning about, okay, I remember when I first started, I was like, okay, because I like things in steps, right? Okay, this step, and then this step, and then this step, because that's what my medical training was, right? It's like you do your undergrad, and then you write the medical school admissions test, and then you get into medical school, and then you do your clerkship, and then your residency, and then you graduate, and you're a doctor, right? Step, 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 step. If you pass everything, you get to be a doctor. But like in acting, it's like, okay, here's the step. You get your agent, you do your classes, and then you get the auditions, and then you get a job, and then you're good. No, not at all, right? Like you can have literally zero training in acting and become so famous. You can do all the training in the world and be so ready and talented, and nobody will ever see you. So I think for a type A personality like myself, I definitely struggle with that at the beginning. I still do, obviously, but I think it's the idea, okay, like you gotta enjoy the class part, because that's the joy I find of it. And if the auditions come and you get to play, that's just a bonus. But yeah, my stepwise thing was, okay, you get your agent. That when I was first starting, okay, you need an agent first, because then that's how you get in the room. That's how you get in the door. Okay, now I need to have a demo reel. Okay, now I'm going to get my first actor credit, because then that's how I get in. It's a step, step, step. But it's just, it doesn't work that way. I remember
what do you mean? Everyone gets an actor credit. That's how it works. They're just giving them away.
And then that's just the doors are open to you. And then here is your show that you will be on for the next 20 years.
Here is your Oscar.
Yeah, exactly. And I think, yeah, it's tough. And I remember, I think I was listening to a podcast, I think it was like an acting podcast, and the person had said that as the frustration of there aren't many jobs in the world that you can have literally no training and be successful at it. Like, you can't be a lawyer, you can't be a doctor. You go through the training, and if you have the training, you can do it and be successful at it for the most part. Acting, no. So I guess it's learning how to enjoy the training part of it.
What's interesting too, I was discussing, there was an agent that represents not only child actors, but quite a few child actors. And that sense of play that you have as a child, if you can maintain that as an adult, I think you'll go so much farther as an actor, because you're out of your head and you're just you're in the moment. You're not second guessing yourself. You could look ridiculous. You don't care. You just do it. And it's so fun trying to reconnect with me as a child. But I mean, yes and no, because I was also an adult child, the one that's always that person that, guys, let's be serious, okay? Let's not play. This is serious playground stuff, okay? Sandcastle, how are we building it? Where's all the so my childhood play needs a little work, but that sense of being free and open to wherever the scene will take you.
Yeah, and I remember, I think that was a part of, I'm sure some classic Meisner, Stanislavski, whatever, the great acting teachers all talk about that. And like everyone that I've kind of been instructed by during this pandemic has said something along the same veins, right? Like, when you are a child and you are being an astronaut, you are an astronaut. It's not you're pretending, you are an astronaut. And I remember, I can't remember which teacher it was. I think it was at LB. But she was talking about, it was just something that was just so like, duh. But she's like, yeah, if you're ever on the stage and the stage direction or wherever, on set, whatever, the direction is, you're looking for your keys. Don't pretend to look for your keys. Like, actually look for your keys. And I was like, oh my God, like duh, that's what it is. Like, actually do it. And then that is so much different. I'm like, oh, where could my keys be? It's like, no, like, shit, where are my keys? And it just makes
where
sense.
Are they?
Yeah, could they be over there? And it's that whole like honest, genuine, and real that comes from like the second city, being like, honest, genuine, and real. It just makes so much sense, but it's so hard to do. But just kind of getting into that like child. I'm not pretending. I'm really an astronaut. I'm really looking for my keys, but it's so hard. That's why I think sometimes the background acting has been really fun, because it's like, okay, I'm working as an admin staff in this wherever. I'm legitimately typing on my computer a note for my boss, and I will like not just write like ASDF 1 2 3 4. I'm gonna write, Dear Mr. Jones, thank you for your email. So I don't know. Is that method acting? I don't know.
You went full method with that. You prepared. You had a whole memo. You had a schedule for your boss. Did he follow it? I don't know. You'll have to watch whatever you were doing to find out.
Watch for the blur in the background. She has intention.
I want to. If you end up seeing yourself, please send me that clip, and then I will reshare it to whatever social media, if anyone feels like looking at it, because I love when people find themselves. I just get so excited. I love watching even the commercials or the little 1-bit roles. I go, I see you. And then sometimes the actors don't know. Like, oh, that came out. I did that a year ago. Weird.
Yeah. Speaking of classes, this is totally a bit of a different subject change, but I have to make a plug for this cool class that I just finished.
Yes.
So again, I make no money from this, but it was just really, really fun. Have we talked ever about like KH, like Kim Herden, the voiceover?
Oh my God, I'm obsessed with KH. So yes, we can. I plug them quite a lot. KH casting, obsessed. Kim Herden.
Oh my God. So I just finished the motion capture, the mocap workshop with Ivan.
I already plugged that one, another one. It was insanely amazing. Love Ivan. It was incredible.
I had so much fun.
I want to go do mocap right now. I just need to. Oh, it was so well done. I love how he did it. It was so great.
Yeah. I had one of those moments in class where we were doing a scene, and I don't know what it was, but we were doing a scene from The Last of Us, the video game.
Did you get that scene too? Were you Tess?
Yes. And were you Tess too? I love it. So I don't know what was happening, but like I can usually get, and this is not, I don't know if it's gonna sound braggy, but like I can cry really easily. It's easy peasy. Like I can just, and I don't know what Ivan said to me, but he could like tell at the end of this scene, he was like, okay, go stop for a second. And then he was like, think about this, this is the last chance, blah, blah, blah. And I was starting to get really emotional and like starting to cry. And then of course, me being like the doctor personality, being like, don't cry, hold it back, you look stupid. Then I was like, no, you're in acting class, let it go. I was like, oh my God. And Ivan's like, yes. I'm like, yes. That was the first time I'd had one of those great like breakthrough moments. Ivan Cherry, what a guy.
This is the only field where we can be happy when we cry in Zoom.
I know.
Such a weird conversation to have with my actor friends. Guys, I succeeded. I cried today.
My husband was like, what's wrong? I'm like, I just had the best class ever.
My husband's sitting out there and goes, oh my God, Robyn, are you okay? I'm acting. Not like that, but actual tears. But it's such an interesting, because you're letting go. You're just not holding it in, which it's so interesting that you brought that up, because I wonder if a part of being in the medical field is holding in so much, because I don't know about you, but I feel for some cases that I've had, if I would feel what my patient is feeling, I don't think I would be able to get through the session. It's a lot. When their medical history, what they're going through, it is really intense. And they don't want you to be, I mean, yes, you can be a shoulder to cry on 100%, but they're coming to you for your medical advice or physio advice in my case, and how they get better. So it's a very interesting, it's just a very interesting divide, because you want to be human, but you also have to be that professional person. And yeah, I think you know what I'm getting at. It's very, very, what's the English word? What are we going for here? So you have to draw a line in between.
It's so tough to find the line, right? Because I think you also have to be protective of yourself as well, because if you take on all the grief and sorrow as what's being thrown at you, and I know we've seen this with the pandemic and stuff like that, people always say like, oh, my doctor's so closed off and stuff. And I'm like, yeah, that's because literally, well, and the same with a lot with physio, right? Like you're not seeing people at their best. You're seeing people at their worst. Nobody's happy, really. For a lot, sometimes they are, but most of the time they're not, right? So you're dealing with, like, I just finished a massively busy clinic here today where I was seeing 20 odd patients really cranky about something and really sad, and then you're in the hospital and there's sad stuff going on. And if I was to take and internalize everything, I'd be burnt out already, and I think it's hard because I agree with you. I gotta find that line of, I need to be human. My patients need to see me as human because I feel for them, but I can't feel too much because then I'm gonna not protect myself. But yeah, then you go into acting class. You're like, I need to feel all of the feels, so that you just go to therapy.
Yeah, there's that, of course.
I think you have to as an actor. You have to, because I mean, it's just you have to. It's so tough to you have to feel everything, and it's hard. Acting is really hard.
It's hard for someone like me. I love suppressing my emotions and just coming out, haha, I'm funny and this is a joke. But really, oh yes, I've been suppressing quite a lot. And then as I share this with people that care, I'm like, Robyn, we don't want to hear it anymore, okay? Go to therapy. But guys, this is acting. I'm exploring myself. And okay, you're a little too artsy. Go away. I'm like, fine, I'll just share it on my Instagram lives. But it is very interesting in the terms. I just, you know what? I think there was a certain point when I was doing a lot of pelvic floor physiotherapy. I was treating a lot, and those were cases where it was just so hard to not internalize that.
Yeah.
Because I mean, there's so many things you can relate to as a woman or just as someone. It's a really sensitive area. So I don't know. I think that really affected me quite a bit.
Yeah.
So I find with that, like now I always try and I just refer. Now I'm just doing more musculoskeletal, whatever. But that was 5 years or so doing that, and it was just very, very helpful. But for me, I think I was internalizing so much. I'm like, you know what? Maybe let's just do MSK stuff.
Yeah. Well, I think that's really important, right? Because you have to take care of yourself, and because then, yeah, if you burn out, you're no good to anybody. But I think that's really important and a really smart thing to have recognized. I mean, a lot of people don't recognize that. And they're like, okay, this isn't bringing me. Yeah, it's helpful for people, but is it bringing you joy? Then I think.
But isn't it so hard to say? Do you struggle with putting yourself above patients? Is that fair? Okay. I just think it's because like you went to school to help people. Yeah. And you're like, well, no, I want to help as many people as I can. So whatever, I'll deal with myself later. Oh, okay, maybe I should deal with myself now. It's just... Yeah.
And I think I've become better at that. Saying, I'm sorry, I can't squeeze you in today because I haven't had a lunch break. I haven't eaten in 9 hours. Like I'm just run off my feet. And you feel guilty. But it's kind of, you just gotta, I don't get, sounds harsh. You just gotta get over it,
No, that's not, I think that's fair.
It's so hard to do. So hard to do. And I think.
I was going to say, I always preach to people, you have to put yourself ahead of other people. So I mean, easier said than done, I find sometimes, but I love that you know how to do that. I really do. I commend you.
Yeah. I think, obviously I'm not great at it, but getting better. And better than I was when I first started my practice, where I was just like, I want to do all the things for all the people at all the time. And you realize you're working so much harder than your patients are. And you're like, oh my gosh, like why? And I think it's also, you can probably relate to you're so naive when you come out and start your practice, when you're like, everyone's going to do all my exercises that I tell them to do. They're going to do this, they're going to do that. Yay. And like, also because we see part of our patient population will do that. They're like the elite athletes, the really motivated people, but a lot of people don't. And then you're like, but why? Why didn't you? And then like, I was like, you're so shocked. And then your like wizened colleagues are like, oh, Janet, don't even bother. But maybe if I discuss weight loss management for half an hour with the patient, they'll hear me. Oh.
That's a tough one. And I find I inadvertently had a discussion with a patient, so long ago. And this is, again, not betraying confidentiality because she loves the story and she shares it with everyone. I had just said, she said she had knee pain. And I said, if you lose weight, it'll take some pressure off your knees. I just kind of threw a comment out there. And it stuck with her. She lost, I can't remember, she lost at least 12, 15 pounds the next time she saw me. Like, what? She goes, yeah, I heard your comment. I didn't know you would take that in. So I'm very proud of you. I mean, she was super happy because her knee pain was decreasing, but I thought, you never know what anyone's listening to. Kind of a throwaway line. Yeah.
And I think for every 100 people that go and they don't listen, there's that one that does, and that changes their life, right? So it's worth it. That one person. Absolutely. Yeah. Mm-hmm. Oh, I like that story.
You don't have favorites, but it's one of those thank you for listening because I want to help you. So I'm glad that you were able to help yourself. It was a proud moment. That's what it was. It wasn't like, way to go, Robyn. It was, I'm so proud of you because that's hard. That's really hard to do. And I know this stuff. I will 100% admit I am a terrible patient. I tore my hamstring. I can't remember when. And just getting that diagnosed was a process and a half. But doing those exercises, oh my God, no one likes starting at the basics. I'm like, what is this basic exercise for strengthening? No, thank you. I'm better than this. Oh no, I'm not. And now I have back pain. And this is why we do that. So it's very hard being a patient and starting from the basics. I'm not a fan, but it does help if you put the time in. Yeah.
Yeah.
Are you a good patient?
Oh God, no. I was just about to say the physiotherapist I work with is wonderful. She's just the best. But you know, like, for example, I went for a lovely 10K run on Monday. It was beautiful outside. I just come back from a wardrobe fitting. I was feeling really good, and I went for a 10K run, and I came back. I hadn't ran that far in a really long time, and I was like, oh, I'm having some like back pain and some knee pain. Whine about it. I was not getting any better. And so the physiotherapist I work with, this has been a long-standing thing. She's like, if you whine about things and don't actually do the exercises I told you, you're going to put $1 in the jar every single time you whine about it. I'm like, okay. So if I whine about it and not do my exercises, this is not going to get better? I'm the worst patient.
Wait, who keeps the money? What is...
Oh, I
want in on this. Okay.
I think it's like a hypothetical jar. I've yet to do it. I just bring her treats. But, oh, and she just joined, too. Yeah. But
well, let's discuss how she's going to monetize on you not doing your exercises. That's
exercise and just whining about things. Yeah.
But it's so hard. It's sometimes, okay, yes, we all have access to a point of being able to do them, but it's so frustrating, and I don't know, sometimes I just don't want to do them. So yeah. I can relate when people come in and say they don't do stuff. I'm like, I get it. That's fine. You know what it is? I just hate when people would pay and say I didn't do it. I'm like, I don't know how I can help you because I planned on progressing today, but I guess we'll figure it out of some of your exercises.
Yes.
Oh, that's so funny. This is a recurring theme. I love it. I love that you can admit that. Why not? We're all human.
I know. It's true.
Do you mind if I ask what your practice looks like now with
yes.
COVID? I'm just super curious.
Yeah. So my practice right now, so I trained in sports medicine. So I did family practice training, so family medicine residency, and then an extra year fellowship in sports medicine. So I have a sports medicine practice, and then I practice in the hospital doing something called surgical assist. So anytime they need an extra set of hands in the operating room, there's a on-call like rota. There's 7 of us in town, and we rotate like each day per month. And so I'm doing like phone triage one day for my sports medicine. So like calling up my referrals and just chatting with them about their history. And, most of the time, like, didn't know how you were going to assess my knee over the phone. I'm like, yeah, well, I've been doing this for a year now, so okay. But it's amazing.
You can do that over the phone? Because I have told my family I cannot assess them. I've been very adamant. Okay.
It's not so much the assessment, it's it's just like chatting about their history and what they've tried and not tried so far. And it's amazing how much I can prevent. Well, I hate the word prevent because like I can see people in my office safely. We're very safe in our office, but people who haven't tried things like physiotherapy yet, because they wanted to chat with me first or whatever, I'm like, yeah, try physiotherapy. And they try physiotherapy, and oh my God, it works. They don't ever actually have to come see me. Phenomenal. But then I'm in the office 2 days a week here, and then all the rest of the days I am either doing my surgical assist or like I have my 1 day a week that I do my like acting classes and my like acting fun to like work on that part of my world. And it's awesome.
That is awesome. I love that. I really do. I like the variety too. And I find it so interesting that people, I think no matter what I tell a patient, it would be, I have to hear it from the doctor. Mm-hmm. There's just, I need to get diagnosed from the doctor, mm-hmm. which is odd because anyone can go, I don't know if this was always the case, but at least as long as I've been practicing, anyone can come to a physio. Maybe that wasn't always the case mm-hmm. back in the day when, I don't know, OT and PT were a combined degree and a bachelor degree before it was a master's. I don't know. I'm curious as to, because I'm all about conservative. How can we do it conservatively versus people, I'm going to see a surgeon. I'm like, that's your choice. Mm-hmm. Cool. But I don't know. I find it interesting that people go to doctors. But then I think maybe I would want to see a doctor. They have a couple more years of school, maybe.
Well, I think there's kind of the two streams of people that we see, right? It's the people who go like, oh, I've got knee pain or what have you, and they go down and they've tried all the conservative stuff, and they're like, you know what, it's not working. Come see me or whoever. But then there's the very cautious people who kind of fixate on that diagnosis, and they want the diagnosis. So I mean, it's funny. Like there's even like I had a patient earlier today who was like, but what's my diagnosis? I'm like, I don't know, chronic midfoot pain. And they're like, okay. I'm like, but my diagnosis, I'm like, that's your diagnosis. Like, oh, okay, awesome. But just having the like title of here's my diagnosis was enough for them. Like, I think whatever is empowering, perfect, that's great. It's even better if there's some like eponym, like de Quervain's, I have de Quervain's.
Okay,
like,
can we discuss de Quervain's? I have had so many people reach out to me regarding everyone seems to have de Quervain's during COVID. This is a thing. I am fascinated. The number of people that have reached, I'm like, and they're not, there's no people that wouldn't fall under the category of having it. I'm like, what is happening? What is it? Is it like they're texting their thumbs in a weird, but I don't, it's odd. I thought it was interesting. Like, wait.
Interesting. It's a pandemic.
It can only be de Quervain's, but why do you have it? I don't know.
I'm gonna keep an eye out on that.
I'm just curious. I would love to, we'll discuss. We'll have a research study after this.
I can only assume it's related to here.
But again, that's what I thought as well. We're doing this more, and that's pretty much what I told them. Like, that makes the most sense to me. But that was just, you brought it up, and I'm like, let's discuss, because I'm curious. But I also think it would be funny if you're the doctor that just says patellofemoral pain syndrome, and those are are you the one that just does, there you go, you are PFPS, go to a physio?
Yes. I write that back to the note to the doctor, because that's all they really understand. But then it's the, let me, what is it? Okay, your kneecap is in a track like a railroad track, and when you extend your knee.
I've never heard the railroad track one. I like that.
Or like I always say, the quads are 4 muscles, right? You've got your 3 of them working, like lateral, rectus, and one underneath. The medial one's not working so much. They're like pulleys. I'm like, I have a physics background, and some kids look at me, they're like, okay, my knee's a pulley. I'm like, it's a pulley. Get excited.
I love that. I really do. And you know what? I don't know what's going on with the vastus medial. Okay, no, it's not getting any love, because the number. Why isn't that stronger? I think we should be training every single athlete, guys. Just strengthen that. That's it. Yeah. Quad specific. I'm just gonna make it easier for. Okay.
I still remember when I was working with in professional football team. Let's just put it that way. And I remember one of the players tore his ACL on the field, and I remember like bringing him off. He could ambulate. He was doing well, but the VMO, that vastus medialis, it looked like somebody had popped it with a balloon. It was just gone, and I was like, how? Like, it literally gone within like half an hour of this injury. It's the worst. It's the stupidest muscle.
For those of you that aren't aware, so the quad, there's 4 of them, but the middle part that's closest to your inner thigh, that's the one that's usually weak, which is again, this is just a conversation. We're not diagnosing anyone.
No.
FYI. Just having a discussion about muscles. It's fun. But I just find that there's that, and the hamstring to quad strength ratio is also very interesting for me. And I find either it's super quad dominant or not. It really depends. So as a runner, do you have strong glutes?
Oh God, no.
Okay, yeah, you're those people. All right, you have a category.
Yeah. Well, it's true, right? It's so sports specific that we see, right? Like, you're going to be quad dominant with your tight hamstrings if you're a hockey player. Like, I always tell, like, it's funny, you get like patient on your table and you just tell them the straight leg raise and you move their hip in and out, and I'm like, you're a hockey player? How did you know? I'm like, oh, it's like I've seen these before, right? But
it's so funny though. I don't want to follow a pattern, but I think for certain sports there is, again, don't want to be biased, go into every assessment, everyone's new, but it really is interesting. It really is.
Absolutely.
especially since the training, I think, keeps changing and they're trying to, add agility or, oh,
Mm-hmm.
what's the jumpy thing? I can't remember words.
Plyometric.
Thank you, plyometrics, the jumpy thing. I like the jumpy thing. And just different ways to train, but certain things are always a pattern regardless. So
Yeah,
it's pretty cool.
absolutely. And I think that's what I love a lot about sports medicine is the patterns. Because I think, again, when you can identify it and then also identify the sport, I think that's what really can connect you to the athlete, is when the athlete feels understood and like, oh, I'm finally seeing someone who understands my sport and the, uniqueness of it. And that's, I enjoy that part so much, like, being like, oh, like you have pain because you do this, like cheerleading, volleyball and stuff like that. I'm like, yeah, like, welcome to the club of these athletes who have a very similar injury pattern, because of the movements you put yourself through. I love sports. I miss sports.
Thank you for saying that cheerleading is a sport, because I watched a cheerleading 100%. Documentary. Whoa. Yeah. I mean, I've always had respect for them, but just a whole other level of what is this athlete?
Yeah. They're incredible. I think there are being I think they've gotten up the higher level of being trying to get into the Olympics. They've been like, they're not in the next one, but like I think maybe 2 Olympics from now they'll be kind of one of the like experimental sports or whatever, which is awesome because that's for some reason the legitimacy is if it's an Olympic sport, which is garbage. But I love watching cheerleading. They're phenomenal athletes. They're unbelievable.
I don't even know if it raises the legitimacy, but I was watching the documentary I watched on Netflix. I think it was called Cheer, and it was based around Navarro College, and those athletes only had 2 years in cheerleading, and then they're done.
Yeah.
So it's almost as if you could go on or you could be training for the Olympics, or I love that there could be something else other than college, and I think there were other competitions I can't remember. But I love that you could, if you have a passion, you don't just end after a certain point in time. That being said, I mean, how long will your bodies last? It is so intense, especially the people they throw. Ooh. Yeah,
absolutely. It's a full contact sport. Like, it's nuts. I love it.
Remind me, other than running, did you do sports?
Not much, which is funny given my career path. I'm like a very competitive person with zero like athletic prowess to back it up. So I was like a very annoying team sport player, because I'm just not talented in that way. But I did a lot of dance. I was a competitive Irish dancer, competitive Highland dancer, and still am Irish dance. I had class last night. And running has been a new thing for me since moving up to where I live now, where the clinic I work at, everyone is a runner. So I was like, I need to make friends. So I need to learn how to run. And it's funny, the physiotherapist I work with, she made a joke, she still jokes, like, remember when you said you'd never be a runner? I'm like, now I love it.
You're doing a 10K. You're a runner.
I know.
I just ran a casual 10K Monday, whatever, nice weather. I'm like, okay, I did a little lap around a park. That was it for me. I was good. Look at me do my little jog. It's a walk jog.
It's so funny because I can't even believe that those words just came out of my mouth here. Like
casually,
Right, and I never would have thought I would ever have been able to do that. But it's cool. It's not. I mean, I was feeling pain afterwards because it probably wasn't a smart idea to be running on like frozen cold trail, but whatever, it felt good.
There is a true runner's high. I understand that. Do you? Yeah. Ooh, here's a question. Might be controversial. Do you run in barefoot shoes? Because this is a trend that I started a couple years ago. I'm a little obsessed with it.
That's awesome.
Again, you could have a different opinion. This is just discussion, but I was so curious, and I had read a bunch of things on it. I thought, you know what, might as well try it, see how I feel. And I just thought it was so cool. And honestly, it makes running fun. At least for me personally, I'm like, if I'm doing my little run jog, I can feel everything. Look at me go. So that, I don't know, maybe from a proprioception perspective, as I feel more, I'm one with the ground. It's very nature-y. Yeah.
I think, honestly, the shoe that is best for a runner is the shoe that you think is the best for you. I think I run in, like, on the road, on a very compact trail, in trail running shoes. They are heavy. they are probably the wrong shoes for me. They actually are the wrong shoes for me. I got like properly fitted and for like a new pair of shoes that were like the right ones for me. And I had horrible knee pain and shin splints. I was like, just go back to my trail running shoes. This is all about fun. Yeah, I think if those barefoot running shoes make you feel good, make you feel like you're, you know, like running like the wind, go nuts. I love it.
That was just how I run, in my chair.
Yeah.
I really want to go for a run after this. It's still kind of nice out. We'll see.
Yeah, well, now it's inspired you to run.
Yes, everyone will go for a run watching this Instagram live.
Yeah.
Dr. Janet. Chanting her name. And then everyone's sorry afterwards. Help
we
me.
were like, curses. Yeah, I'm sorry.
That's so I want to back. Did you say you were doing Irish dancing yesterday or the other day?
Just, yeah, dance class last night.
Dance class. Okay.
Yeah.
On Zoom.
Yes.
This is Zoom. This is, I don't know why that was my gesture for Zoom. How does that work? Do you have?
Yeah,
like,
so we've been
put the
doing
laptop?
it.
Okay.
Yeah, so I've got like, I just use my phone actually because my dance instructor, so we have this crew of us, like of adult dancers who, some of us have did Irish growing up and were competitive and wanted to just keep doing it for fun, and some of them had never done it at all and wanted to just learn something new, and we've been dancing together for a couple years now. Like there's a group of about 7 of us, and yeah, so we do it on Zoom with our dance instructor, and we put our phones down or laptops down on the floor so she can see our feet, right? Because they don't care about your face, especially in Irish dance, right? 'Cause your arms are down by your sides, nobody cares about your face, it's all about your feet. So yeah, you have it down on the ground and just taking a look at your feet. So you can't hide when you mess up, but it's fun. It's a lot of fun. I mean, I miss being in the dance studio. That's just awesome. But yeah, it's as good as it's gonna get. So I just do it in my laundry room.
I love that. I was talking with someone the other day because I'm a big fan of tap dancing because it's drumming with your feet. But I live in an apartment, so I don't want to bother my downstairs neighbor. So that just seems mean. But I think with tap, I wonder if it would be similar, just showing your feet, because yeah, the upper body moves, but I don't know. I'm gonna ask him about that. Yeah, I'm curious. There you go. That's why we have the discussions. How does it work on Zoom with the tap?
Yeah, I think what everyone's had to modify, obviously, with this pandemic, and so it's incredible what people have put together. You know,
I agree.
Yeah, it works well. You got to do it. You just got to adapt, be nimble, and just enjoy it.
I mean, I know we're all social creatures, and I find it so, as soon as the nice weather comes out and it's like, oh, people, but it's also, oh God, ask. That's just a controversial topic that I don't want to discuss right now. That's just a little too controversial right now. And
well, let's think of the fun stuff like, you know, acting in sports. That's
true. Do you find that having, or at least that ability to act, makes you a better practitioner?
I don't know. It's a good question. I remember Michelle at LB saying, you know, like being a doctor, right, Michelle? Being a doctor, you have access. How did she phrase it? She's like, oh, it's like being in a lab, because you just have access to all these characters that you can see, you know, through your day. I mean, obviously with a mask, it's a bit different. You can like hear vocal tone and like here's an anxious person and stuff like that. So you just constantly can study humans all day. I'm like, yeah, it's a good point. I bet it does. You know, I mean, how can it not? I think I've always been a fairly decent like public speaker, and you know, I think moving up here in a smaller town has made me a better like kind of socializer, small talker, and which is improv, right? So
there you go.
I mean, how can it not? Yeah. Mm-hmm.
I wonder if you have this problem that I have. Do you ever get an audition for a doctor? And then
never.
Okay. So I laugh every time I get a physiotherapist audition, I know I'm not going to book it. It's just apparently my version of a physiotherapist on screen is just not who I am. And I can do the doctor, the nurse, but for me as a physio, the screen is not feeling it, or the people I'm auditioning for, they're not buying it. And I love that so much. I literally auditioned for the College of Physiotherapists. This was, oh God, 6-7 years ago. And I didn't book it. And I thought, I'm a physio. I know. That was the most, again, early on in the career, I just thought it boggled my mind. This isn't acting. This is who I am as a physio. And I'm like, no, it doesn't feel real. Just
doesn't feel real.
I mean, they didn't say that, but that's really the gist of what I took it as. Is not buying it. Not buying what you're selling. Don't think you're a physio.
It's funny because I also met a nurse through LB, similar to you, right? And we were joking because she's like, do you ever book doctor roles? I'm like, no, never. She's like, I never book nursing roles, right? The only thing I've booked that's doctory is I was there's a pilot that hopefully will get made where I was the hand double for the lead actress. And so they needed like my hands to do the surgical stuff. And I was like, perfect, that's awesome. Sounds good. But of course, I get there and it's medical drama. And so in the medical field, we're all like, oh, this is wrong. Oh God, this is wrong. That's not how you do it. Oh my God. But it doesn't matter because it doesn't look good for TV if you do it properly. But so I had to watch the lead actress do her scene in the operating room, and then I had to mimic what her hands were doing close up. And she was holding everything wrong. And I was like, you could hold the instrument this way. And she's like, oh, it just feels awkward. I'm like, it's wrong. But again, it doesn't matter because it doesn't look good on TV when you do it properly.
I love that you brought that up. It is so interesting when I would go on a set and like, that is not how you rehab. That is never going to happen in a physio clinic. And but this is what we're trying to convey. And this is why we have to, and look, I understand there's a vision you have, but the physio in me is just dying being a part of this and watching it like, just maybe don't put my name on it. Okay. Yeah. But again, it doesn't look good on television or film or whatever it was.
Yeah.
It's so funny when I watch rehab scenes because I'm like, I don't actually know what you're doing. Like you are touching their leg, but no, I don't even understand. Is that a manual therapy move? Is it kind of something you saw online? And then I don't know what the scene's about because I'm just staring like, what is that? Why didn't they have? For me, I'm like, why aren't there physio consultants? Why are we not on set? I think there are some kind of medical jargon consultant. I think there, but I don't know if there are, because I don't think it's important enough. It's like, I don't know, rehab, touch a patient, it's fine. But that's just my opinion. And if they're actually, right, it's okay. Just massage, whatever, it's fine.
Yeah. Well, I met, on the show that I was on, the medical one, there was the medical consultant there, and he was advanced care paramedic, nurse practitioner, and physician assistant. Hilarious guy. We had such a blast because everything was just him going, and we were building together because what we love to do and what we're doing now is make fun of the medical and the rehab shows, right? Because that's so fun. Grey's Anatomy, their stethoscope's in the wrong way, blah, right? And so we were laughing about a scene that they were filming where they were scrubbing in. And scrubbing in for surgery is my all-time favorite thing to do because I think it's so it's calming for me. It's meditative. You do the same thing every single time. You feel like you're doing this rite of passage that every surgeon has done since the dawn of sterilization or whatever. Anyways, I love it. And so I'm a little bit protective of how to do it. Oh, and also I was taught by a really awesome, badass, German nurse. So how to do it. So I know her method of doing it. And so we're watching the scene being filmed and they're scrubbing in. And as they do, they scrub, hands are all ready, it looks really great. And then they go and they put their mask on. And I'm like, done. You just what was the point, right? You just ruined everything. And that happens in so many films. I remember it happened in Doctor Strange, and my husband was a doctor too. We were both just and the medical consultant and I were laughing about it. And he's like, I tried, Janet. He's like, I tried to tell them, this is all wrong. You're doing it all wrong. People are going to make fun of it. The doctors and nurses are going to know, but they don't care, right? Because you need to see the person's face. They don't want to see your mask and stuff on. You can't have a dramatic conversation with your father. all sterile.
With your lover. It's usually a lover.
It's true.
Something didn't go right in bed last night, and I'm scrubbing. I'm taking it out and ruin it. Okay.
But I think that it is half the fun, you know, like having all the conversations with your medical colleagues.
My version of scrubbing, by the way, was filing my nails on my hands. So thank you, Kanye. Just
But yes, it was fun. So hopefully this pilot gets picked up because you'll see my hands doing the things that doctors do. The only time I've gotten to use my doctor prowess in the acting world, probably for the rest of my life.
Oh, you say that? What? Please, it comes out and whoa. Whose hands were those? And then you become a hand model, a doctor hand model, very specific. And then you just book all these random gigs, and so you'll walk around, you'll be unknown, so no one's gonna harass you in the street, but you'll be that doctor.
Like these hands.
That surgery that you watched last night on TV? That was me.
Those are my hands. It was so fun. It was a blast. Like what a ridiculous thing to do. And it was just like, this is the best. It was the best like little break from like, again, we're talking about escapism from this pandemic world. And then it's just such a great story. Because I'm like, guys, I was in the operating room the next day. I was like, guys, guess what I did yesterday? I was a hand double.
I didn't know. I really didn't know that was a thing.
Me neither. Until my agent called me. Neither did I. My agent called me and she was like, Janet, I have a doctor thing for you. Oh my God. Please tell me you can do it. I was like, I have to. It was awesome.
That is really, really, but it's so funny too, because again, there is that continuity of what was the actor doing, but also I want it to be as real as possible. That is so cool.
Mm-hmm. Yeah, it was great. It was so fun. Yeah.
Excited. I think it's gonna make it. I'm excited to see that. I've decided, and then we share it everywhere, guys. I know whose hands these are. Keep it on the DL. But what if the actor whose hands you were just only plays doctors, and then you're her permanent hand double?
And you know what's funny? My husband actually said that. And so what was also funny was so my hands are like, I have no fingernails because I have to be in the operating room. You can't have long fingernails. My hands are just like garbage. So, but you're wearing gloves, so it doesn't matter. Like, it's not like I'm going to be in a commercial like Vanna White, right? It's going to be, you wear gloves so you can't actually see that my hands are a bit of a mess from operating. But where was I going with this? Oh, right. The actress, who I can't name because I signed my life away, was so interested in what I was doing. And she said, teach me this. This is so cool. I'm such a nerd. I want to learn all about this. I was like, I don't want you to get too good because I kind of want to get called back.
Even honestly, I don't think that's a skill you pick up in one day, but I admire her wanting to learn. Right? You only went to school for how long, but yeah, you can learn it in a day.
Yeah, you can learn. No worries.
You know what? Here you go. Just come to the operating room with me tomorrow, and we'll do it together. There you go.
Yeah.
Can you imagine saying to a patient you're going to operate on, hey, I have this actor wants to go very method. Do you mind if she cuts you open? Is that cool? It's a lot of consent forms.
It's another world of like, it's considered background, right? It's like part of like extras. Like I was in like background holding and stuff. And this whole other world of like hand double. And there was a male hand double as well, who was like the male actor's double. And then it's the same as like the photo doubling, right? Or the people who stand in. That's what I'm looking for. I was like, this is a thing I did not know existed. This world, the medical / entertainment world is just fascinating to me. It's all fascinating.
Yeah, I'm very intrigued. I gotta advertise more. I gotta be, hey, I know that you hired this person to be your physio, but hear me out. I guarantee they won't know what to do. So just let me come in. Just don't make me use the ultrasound machine because I have thoughts on that. But everything else, I have thoughts and there's research, whatever. But let me do it. Let me do a little treatment, and then
authenticity.
Just kind of whatever. Just move them properly. That'd be cool. I don't think there's as much demand. I really don't. Let me be like, no, it's fine. They're doing exercises there. I always discuss. I don't know if you've ever watched Frasier. But so it's this comedy.
Not much.
It's a comedy, I guess. Yeah, It's funny. I thought it was funny. Two pretentious brothers, very entertaining, and they're getting into all sorts of mishaps. Anyways, the reason I bring it up is they had a housekeeper. So a housekeeper who was a physiotherapist. And I never realized she was a physio till I rewatched it and I thought, whoa, wait a minute. Is this why people, when I did home care, thought I would give them a haircut? Because this is not what physios do. They're not going to do your laundry and marry your brother. That's not a thing that happens. I gave away Frasier. Sorry, but it's been off the air for a while. It's just so, it was like a stay at home or live in nanny / physio. And those could exist, but no.
Yeah. Fraser ruined it.
Yeah, I had some thoughts. So
that's
if
so
it comes
interesting.
back, just
I think, you know, that happens kind of in our world as well too. Well, I think also that I get either you're a sports doctor, so like a physiotherapist. I'm like, no, like I know a couple exercises to teach you that my physiotherapy friends have taught me, but like you need to see like an actual physiotherapist. Like they're way more trained in this than I am. Or I get the like, okay, so I'm also having trouble like with my blood sugars, so, like my diabetes medication. Can I talk to you about that? I'm like, I don't know. It's like, but you went to medical school. I'm like, yeah, like 10 years ago now, and I promptly forgot everything I don't need to know. It's like, I can deliver a baby. I could. If I was on a plane, sure. Any doctor can deliver a baby. If you kind of want your baby delivered by someone who does it every day, if possible, you know, it's like, I don't remember anything about your diabetes medications. I'm sure I probably could think of it or figure it out, but maybe you want to see someone who actually does that every day. But it's weird. Well, what people expect to think.
I really do, because again, it's that doctor. Oh, so doctor, you must know everything about everything. No. Which is, I don't think anyone knows everything about everything. I think that's why there's so many different branches of medicine. And
absolutely. You know, we always talk about like family medicine, you know a little about a lot, and then you specialize, you know a lot about a little.
I've heard that. I love that.
Me too.
But I love specializing in something. I think that's what drew me to the pelvic floor. I love knowing so much about one area.
Yeah.
Because you can learn, I find every area to be fascinating, but when you hone in on something and you just learn so much about it to a point where people don't want to hear it anymore, stop talking, Robyn, kind of thing. I don't know. Maybe I just like being an expert in things. Maybe that, I use the term expert loosely, but just having this vast amount of knowledge about one area that I think maybe this will come in handy one day. I don't know.
I agree. Yeah.
I just also hate not knowing about other things too, though. So that's why if someone would ask me about the blood sugar, I'd be like, oh, I hate that I don't know this anymore. You know, but again, you chose to specialize in one area, which is you're really good at that one area. Yeah.
Yeah. Yeah. I think there's that feeling of, I'm glad I can be that expert in this for you so I can help out like my family medicine colleagues who are like, awesome. Yeah. I remember my RMSK unit in medical school was like 2 weeks, and it's like the biggest thing that you see in family practice is MSK, but we spent 0 time on it in medical school, and that's notoriously across the country. And I was like, yeah, I'm happy to be the expert on that for you. But then it's that little fear, that like imposter syndrome that comes in that's like, oh God, I'm the expert on this? Nah, I want to find the bigger adults. Where's the bigger adults in the room? I can't. Oh, I am the big adult. Okay, shoot.
I feel as though everyone's walking around with some form of imposter syndrome, and we don't give ourselves enough credit. No, we know this, and they're coming to us for a reason. And I find that so fascinating because we studied this, we know this, and if not, we'll research it and we'll figure it out. And we have colleagues that we can work with. And I think that's what's so amazing about healthcare nowadays. It's the technology that's available to us. Back in the day of whatever, finding a research article was a job and a half. And now it's just search engines, research available. It's on Instagram. It's everywhere. I'm just, oh, look at this, my daily little physio article of whatever that is. It's so available. And sometimes I think that might be a bad thing if it's the public sometimes overdiagnosing themselves, which I'm like, oh, that was an interesting diagnosis. But sometimes people come in, you're like, that was a really good diagnosis. I don't even think you needed to pay me. Well done. Yeah.
Yeah. Good job.
That was spot on. You know your body very well. But
Yeah. Well, I think like imposter syndrome, yeah, we talk about it a lot and about how there's people who are more prone to it than others, females, we're definitely more prone to it and blah, blah, blah. Let's just say like gendered females, whatever the correct term is. But there's definitely a good side to the imposter feelings as well, too. Like exactly what you're saying. If you recognize them and you don't know, then you learn more. Right? And that's the why we are like kind of constantly in school is, we want to learn more because we genuinely are interested. It's that scary person who is like, no, I know everything, and they're kind of rigid and don't want to accept, what's the word? Don't want to accept, criticism or critique or, advice. Like that's frightening in the medical field, like terrifying if you ever get somebody like that, which thank God, like you were saying, doesn't happen very often because usually healthcare is very collaborative. But, it's scary, I think, in other fields as well, too. And in acting, it's tough because I think we are very kind of emotionally sensitive people, which is what makes us so good at like tapping into the emotions that you need. But it can be really hard to get that criticism.
Yeah, it definitely is.
Mm-hmm. Yeah.
I love how we've had a healthcare and acting discussion. This might have been my first. I'm just like, yeah, ACL, but also acting.
Also acting. It's funny. When I people like at the start of like any class, right? Online or I'm sure in person, like, who are you? What drew you to acting? What do you do? Blah, blah. And it's always like, hi, I'm Janet. I usually say like, I work in healthcare. And then like Michelle at LB be like, she's a doctor. And I'm like, oh God. And then like, what drew you to acting? I'm like, oh yeah, I'm trying to, prevent burnout, use my creative side, because for so long I've been kind of like right-brained and scientific-brained. I want to try and use my left side, creative side. And I did a class with Daniel Balmander, who I'd never done a class with him before because I'd just been with Michelle. And then I had said that and he was like, interesting. He's like, acting, he's like, can be very scientific if you want it to be. He's like, you could hone in if you wanted to on your right sciencey side of your brain and see everything that you're doing as an experiment. So here's your hypothesis, try a scene this way, experiment it that way, and see what happens. And of course I was like, oh, here I am with my like excuse for why I'm acting, trying to be like my creative side. Where of course Daniel's like, no, like acting can be very scientific and right-brained. It's like, if you want it to be, oh, okay.
Yeah.
It's true.
It is true.
Mm-hmm.
It's so funny because I study with Lewis and Daniel, and it's just like a little mini Lewis, but also in a different way, in a very, so it's bits of Lewis, but also Daniel's his own person. So I love that you can study with the dad and the son. I just think it's so cute.
So cute.
Oh, this is like an LB love fest. I'll tag them in this afterwards. Hey guys, you're awesome. I mean, again, I hate just plugging one place, but I love LB. They're great. So they do good stuff.
Yeah, I agree. Yeah. I've been in classes like with a ton of different places, and I love them all. I think they're all great. You meet the coolest people.
That's the thing too, and I know I'm studying in a different place now, just because I don't remember how I found it, and it's almost as if it's the actors there too, right? It's a new group of people sometimes, and it's a different energy, and I think every coach gives you little pieces of advice that you take with you. It's so hard because normally when I go to a different place to study, I just change who I am as an actor. I'm like, I've grown out of that. And I'm like, okay, what serves me and what can I take from this class? But I love seeing how other places operate and what their approach is. And I love learning. I just feel as though I love learning more about myself. Because I don't know, as I wonder if that was the healthcare person in me, part of it that's always, okay, let's learn about my patients and let's figure this out. And then it's acting is kind of a time for me to explore within. That sounds so artsy and I apologize.
No, well, it does, but it's true.
God, I'm that person now. Oh God. But no, but it is like, I can't, if I don't know who I am or where things are coming from, then I don't think that's good.
Yeah, and I think like I said, we talked about at the beginning, like are you a better physiotherapist because of your acting background and vice versa, right? And like, how can it not positively impact whatever career that you're doing because of your interactions with other humans, but also the learning part of it, right, is so kind of driven. And again, it kind of comes way back full circle to the beginning of our conversation about if you don't find the joy in learning the acting part, and if you're just focused on must be in Netflix feature or whatever, you're just gonna want to quit, right? And I think, yeah, I love the learning part, and I find so much, like, again, this is the Sunscreen joy from like the acting class part of it, and even also like the like script breakdown part of it, like the sides breakdown. Like, I think that's because that's so academic and I love it. I'm like, yes, let me just research this and then dive into each little nuance of what they're saying. But it's fascinating. And I think also
script breakdown, I agree. Yeah.
Yeah.
That's a process and a half of wow. If you have a good piece of writing, you're, whoa, this was well written. And and it's also, how did I not see that? And then when someone helps you break it down, you're like, oh, that's what that meant? That's that's not how I delivered that line. Oh, okay.
Well, and it's just finding different ways to do it, and it's no right way. I mean, if you're in an audition and they're like, oh, okay, you delivered your lines the way that we imagined the character, you get the part. She delivered the lines great, but it wasn't the way we imagined the character. She doesn't get the part, because that's how the entertainment business works. But yeah, it's that it's so interesting. We had I just finished a class at Armstrong, and we had like the same scene. All the females had one scene, all the males had another scene, and so all of us, we were prepping the same scene, right? And then seeing how each other did it. It's so fascinating. It's just completely different. And it's interesting to watch. And of course, everybody has their own way of breaking down things, and they'll tell you their way's the right way. Just like in medicine, like all the special tests that we do and stuff like that, like you're doing McMordie's test wrong. This is the right way. Next doctor, you're doing it wrong. This is the right way. Oh, come on. Just find the way that works best for you.
Or someone you're still doing that test? What?
Yeah, come on. Oh, you're still doing Meisner work? Ugh.
I love the crossover so much. I really do. So interesting. My husband signaled me a while ago. It's been over an hour and I don't want to take up. I know. I love chatting with you. Getting consumed in our conversation. I greatly appreciate you doing this. I'm so excited this worked out. I was like, oh God, will we be able to talk? I don't know. But yes, we were.
It was awesome. Yeah, I love finding all the different crossovers between our two worlds, sports medicine and acting.
I am definitely going to share, if you don't mind, the hands double. Again, this whole talk was fascinating, but the hand double is something I was not aware of.
Neither until a month ago.
That's amazing. But is there any final words you would like to end on? Zero pressure, or we can awkwardly end it.
Oh, I don't know how do people.
I'd like some clever doctor words, if you don't mind.
Wear a mask, wash your hands, and get your COVID vaccine, please.
That was Dr. Janet. I like that. That was good. Do you go by Dr. Janet? That seems, or do you laugh?
I don't know. Most people just call me Janet in clinic. So I love when patients call me doc, and it's usually like my older male patients. Hey doc, how's it going, doc? Hey doc. I find that so endearing. Maybe some people would be like offended by that word. I love it. I just think it's so cute.
That's adorable.
Hey doc. Hey doc. I'm like, oh hi.
Please let me know if someone goes, what's up, doc?
What's up, doc? I think that's probably where it all came from, and they're probably just holding in, not wanting to say it, but I would love it if they did.
So if anyone is a patient watching this, please say, what's up, doc? That
friends for life.
Says it tomorrow. That's oh, you watched my Instagram live. Interesting.
Yeah, that's right. Yeah, it's like, what have I gotten myself into? Oh no.
I think I will end this. This was all just a chat. No actual medical advice was exchanged. We were just just two friends having a conversation, two pandemic friends. I like that term.
Yes, pandemic friends.
Please, thanks so much for doing this, and enjoy your evening, and stay
Thanks.
safe.
Thanks,
And
you too.
thank you. Send me the footage when all your stuff comes out, because we know it will. I'm very excited.
And hopefully I'll see you on set sometime.
Yes, I hope so too. I really do. All right.
Yeah.
Bye.
Bye.